Thank you again, and welcome to this third module of non-technical skills for surgery in variable source context. During the next module, we are going to discuss about communication and teamwork in the operating room. We expect that by the end of this module, you will be able to define communication and teamwork, list the elements of communication and teamwork, and evaluate communication and teamwork in the operating room, and describe strategies to improve communication and teamwork at your workplace. Communication and teamwork can be defined as skills for working in a team context to ensure that the team has acceptable shared picture of the situation and can complete the tasks effectively. Communication, there are many studies that show how poor communication in the operating room can put patient safety in danger and affect patient outcomes. In surgical cases where communication inefficiencies led to patient complications, they found that in 49%, the information was not transmitted. This means that one person says something, but another person hears a different thing or doesn't hear the information at all. In 44% of the time, the information is communicated but not accurately received. This means that someone says something, but their colleagues understood a different things. And in 7% of the time, the information was communicated but not received. It means that most of the sometimes you say something, but the person you're talking to doesn't get the information you are sharing with them. There are three elements of communication and teamwork. The first element is exchanging information. This means giving and receiving information in a timely manner. It means that give or share the information at the appropriate time, at the right time. The second element is creating a shared understanding. This means that you ensure that the members of the team has necessary and relevant information, and to ensure that the team shares an acceptable big picture of the case. So this means that everyone on the team understands the situation the same way. And the third element is coordinating team activities. This is about working together as a team to conduct activities in a simultaneous and collaborative way. It means that all members of the team are working together in harmony to ensure that they are providing a safe, accurate, and timely patient care in the operating room. The first element of communication and teamwork is exchanging information. Exchanging information is about keeping the team updated. For example, for the surgeon, effective behaviors in exchanging information is about letting the members of the team know how the operation is going and when things are not going according to the initial plan. For the nurse, the examples of exchanging information is about informing members of the team, for example, that the gauze counts or instruments counts are correct, and letting them know if something is missing ahead of time. For the anesthetist, effective exchanging information consists of updating and reporting key events. For example, if the patient's vital signs change, the anesthetist use exchanging information to ensure that or to share the information to all members of the team. Also, effective exchanging information consists of listening to other members of the team. For example, the surgeon has to listen to concerns from other members of the team, from the nurses, the anesthetists, and to discuss possible scenarios that might happen as a result of the current situation. Communicating clearly is about, for example, for the surgeon to identify common language for other members of the team to communicate with. As you know, in our context, people speak different languages. There are people who speak French, English, in Rwanda, Swahili, and most of the time we mix both languages. In a team with multiple languages, we have to ensure that everyone knows or understand all the languages used in the operating room. And if necessary, you have to agree on the common language to use. That language should be the language that everybody on the team understands. For example, for the nurses, the nurses' skills in communicating clearly is about, for example, vocalizing what is being given to the surgeon to confirm the request. For example, if the surgeons ask a suture, the nurse can reply saying, "Here is the suture." For the anesthetist, an example of effective communication is about maintaining a clear documentation and clear communication about relevant information to other members of the team. And for the entire team, effective communication or exchanging information is about using a closed loop communication. Closed loop communication means that when you have to talk to someone, to your colleague, and call them in their names. For example, say, Jude, I want you to give 5 milligrams of adrenaline. And I reply saying 5 milligrams of adrenaline given. That is closed loop communication, because when you say or you use ambiguous communication, no one will be able to implement the orders. For example, if you say, can someone give adrenaline? And you are in a team of maybe 4 or 5 people. No one is going to, it is more likely that no one is going to give adrenaline because you didn't precise. But if you want the orders to be implemented, you have to assign the task to a specific person, and that specific person has to ensure that they communicate back, informing if the orders have been implemented. Some of the barriers to exchanging information can be either internal or external. Internal barriers to effective exchanging information include noise. In the operating room, there is much noise. The noise can come from the people talking, from the instrument we use, from the patient vital sign monitoring devices, from the radio or the music, and so on. Some people speak with a low voice, and that is a barrier to exchanging information. Sometimes it is hard to hear what people are saying, especially in the operating room where we are wearing masks, covering the mouth. It is difficult to hear what people are saying if they don't articulate what they are saying. There is a separation in space and time. So most of the time in the operating room, there is a screen between the anesthetist side and the surgeon's side, the surgical side. So that screen is a barrier to effective communication because sometimes it's difficult to keep an eye contact with the people you are talking with. Sometimes like lack of visual cues and body languages or eye contact, the facial expressions, because of all the things we have in the operating room, the masks, the cap, and we're using the hands, so we're not, when we speak, we are not able to use our body expression to effectively communicate. Those are the barriers to effective exchanging information. Some barriers can be external, for example, language differences, for example, in case of here in Rwanda, where people speak different languages. Culture, there are some things, for example, some cultures where like the most junior people cannot talk to the most senior people. That is language to communication. Motivation, some people may be in the operating room, but their mind is absent, is elsewhere. That is a barrier to effective communication. Different expectation, past experience, hierarchy, emotional or mood. Some people may be in bad mood, like I'm in a bad mood, so I'm not speaking, not sharing information, and so on. Here are some of the few examples of strategies we can use to for language barrier. First of all, is to slow down. We work with people with different levels of like English or French. Um, so when you speak with people, working with people with different levels of languages, you have to slow down to ensure that people understand well what you are doing, what saying. Use a closed loop communication. For example, I will describe the closed loop communication approach in the next slide, and put team members' names on the board and use them. So it's a good practice to put the names of all the members of the team on the board and their functions or their roles, so that you and use them during while communicating in the operating room to ensure that the information is accurately transmitted. An example of closed loop communication, here's a few steps, is the one, initiating or sharing the information. The sender initiates the message. So for example, an anesthetist can ask, if we have two anesthetists, for example, can say, John, give 5 milligram of adrenaline IV, push. And John, or the second anesthetist, he has to repeat back, 5 milligram of adrenaline IV push given. And then the first anesthetist should reply, that's correct. So that is an example of effective closed loop communication. If you look at what is going on here, is that an anesthetist is giving an order to his colleagues, and his colleague implement the order or the actions. And after doing that, he repeats back, giving the feedback, saying, what you asked me to do is all I have already completed. And the other anesthetist confirms to ensure that he got what their colleagues say. For example, on the surgeon, they can say, Jen, give me Victory 20. Jen being the assistant. And the assistant or Jen will say, here is the Victory 20. She's repeating back to the surgeon to inform him that Victory 20 is being handled to him. And then the surgeon said, thank you, I got the Victory 20. Or another example for the nurse can say, for example, the scrub nurse talking to the circulating nurse, like, Josh, give me a pack of gauzes. And Josh or the second nurse would say, here is one pack of gauzes. Let me know when you are ready to count them. As you know, like, a pack of gauze has a number of gauzes, so they have to count them. So, and Josh will reply, I'm ready. Let's count them. So here are examples of how we can apply closed loop communication to ensure that we exchange information accurately in the operating room. And by doing this, we'll be able to prevent many complications in the operating room. The second element of communication and teamwork is creating shared understanding. Effective behaviors in creating shared understanding include communicate in a clear and timely manner, invite all members of the team to share their opinions and give their inputs and contribute to the discussion, ensure that all the team members are in agreement. So in situation where we are discussing about the plans, you have to ensure that all members of the team agree on the plan or the treatment plan so that they know what to do. Examples of ineffective creating and shared understanding include assuming that other members of the team know what you want. They sometimes this believes within some surgeons that the nurse should anticipate what the surgeon needs and handle that instrument or equipment ahead of time. Though that is true, that's an example of effective skills for the nurse, but the surgeon has to vocalize what they want because sometimes, based on the progress of the operation, you may need a different tool, you may need a different equipment. It's good to ask the, the nurses the equipment, the name of the equipment that you want. So some of the examples of effective communication and creating shared understanding, for example, for the surgeon is to ensure that the other members of the team, they share their opinion and that everybody on the team agree on the plan. Some of the strategies we can use to create a shared understanding is through preoperative briefing, where you discuss the plans about the patient, about the team, and about any other thing, equipment that you may need to successfully conduct the operation. During the operation, you have to communicate, use the checklist, regular update of the status of the operation, and conduct the post-operative debriefing. So I'm going to share one tool that was developed to improve communication and teamwork in the operating room. It is called through the preoperative briefing and post-operative debriefing. And the preoperative briefing, you discuss about the personnel, the patient, and the planning. For example, for the personnel, you have to ensure that everybody is present, discuss about any particular concern, if anyone is not feeling well or feeling good and having concern about their health status that can compromise their ability to perform the operation, and ask if there is any specific learning goals for either for the individual or for the team. As you know, we had in the operating room, sometimes we have learners, medical students, nursing students, or residents. We also have like people, staff, or faculty at the junior level who are still learning. So we have to discuss about if there is anyone who has any learning objectives or learning goals and ensure that we know that before starting the operation so that we can help them learn. For discussions related to patients, this can be either related to surgery or nurses, for example, estimated the length of the operation, and materials, instrument, equipment, extra procedural, for example, if you are doing a procedure that will require pathology or where you will need to use intraoperative imaging, that should be discussed before the operation. On the anesthetist side, we have to discuss about any possibility of difficulty airway, any possibility for needing intensive care admission after surgery. And in relation to planning, you have to distribute the task among members of the team and decide who is responsible for coordinating the theater list or the operation. This preoperative briefing can be conducted either early in the morning before you start the theater list, before you start the day. It can also be conducted at the beginning of every operation. Then during the operation, you apply strategies as you saw the stop, status of the operation, objective of the operation, the plan, and discussion about any concerns, strategies to improve communication throughout the operation. Then towards the end of the operation or at the end of the operation, you have to conduct a debriefing. Also, you go through the personnel, patient, and planning. You discuss what went well concerning communication. Is there anything that needs to change or you need to improve? For relation to patient, were there any deviation from the surgical plan? Were there an incident or complication? What needs to improve in patient care? for planning, were there any logistic problems and materials problems, where the learning goals for the people who had like the learning objectives, where did you able to meet them, and assign responsibility for someone to follow up on the things that needs improvement. So this is the preoperative briefing and debriefing. It can be used in addition to the surgical safety checklist because they complement each other. And we will have it, we have a printout of this so you can, it can guide your preoperative briefing and post-operative debriefing as a way to improve your communication and performance. So in addition, this can be complemented with the surgical safety list that you are familiar with and can help you improve and coordinate your team before beginning the procedure. The other element of communication and teamwork is coordinating team activities. Examples of effective behaviors include checking with the team and for example, before starting the operation, the team, the nurse, surgeon, and anesthetist must check if all of the equipment are available. And if necessary, you may need to delay to start the operation to ensure that it is safe for the patient. And any members of the surgical team may coordinate activities depending on the situation. For example, the surgeon may coordinate the operation throughout the operation. The anesthetist may coordinate patient positioning after anesthesia induction. And the nurse may coordinate preoperative briefing, leading the surgical safety checklist before and after the operation, and so on. So everybody on the surgical team is able to coordinate the activities of the surgical team. Teamwork in theater is very important because we often make teams and we have to work together with a lot of people from different backgrounds, and we have to work to ensure that we have to work harmoniously to ensure that the operation goes smoothly. Most of the time, we do not choose members of the team. So you come in the morning, you find that there are people who have assigned in your room and you have to work together. So we have to ensure that we work together, and all of our tasks or our success depends on the skills and the competencies of our colleagues. It's necessary for a close coordination among all members of the team to ensure that we as a team work effectively. We have to use a verbal communication when plans change, and we have to anticipate the needs without being asked. This is like when we discuss before the operation, we know the flow of the operation, or we know how the operation will progress, and we will know when something is changing, and we will be able to anticipate that additional equipment or instruments will be needed. Members of the surgical team have shared common valued goals and objectives. We have to be open and trust our colleagues, because everybody comes to the operating room. They come to work with the goal of doing their best to provide patient care. However, for us to be able to provide the best and safe patient care, we have to work together to support each other, to ensure that everybody is getting appropriate support to work effectively. Now we are going to watch a video. It's about a laparotomy for trauma. The patient has a bleeding liver, and it's a 50-year-old male who presents with right upper quadrant abdominal pain after a motor vehicle collision. His initial exams reveals hypotension and peritonitis, suggestive of significant liver trauma. The patient was taken to the operating room for an exploratory laparotomy. When the scene starts, the surgeon has already opened the abdomen, and we ask you to watch the video and focus on communication and teamwork, and note effective behaviors of communication and teamwork as related to exchanging information, creating a shared understanding, and coordinating team activities. So observe the surgeon, the nurse, and anesthetist. You can choose one of them to observe and then note down what you note. So I will put the link to the video in the document, and then you will have to go click on that link and watch the video, and then use the non-technical skills assessment tool to describe what you observed and rate the communication and teamwork skills of the actors in the video. So take a few minutes to watch the video and to write down what you observed as effective and ineffective communication and teamwork skills for these surgeons, nurses, and anesthetists. Yeah, thank you for watching the video. As a summary, teamwork and communication is the ability to diagnose the situation, reach a judgment to be able to choose appropriate course of action, and it has three elements, which is about exchanging information, creating a shared understanding, and coordinating team activities. Thank you very much. We'll see you next during the following module.